Hello. Let's see. Oh, I see you guys are coming in. Oh my gosh. I always get excited. I got so excited last time I did this webinar. While people are still making their way in, we're going to go over a few housekeeping. Hi, hi, hi. Oh, yes. So we love questions. Leave your questions in the chat widget. We'll do a question and answer session at the end. So just make sure you stay here until the end, and we'll definitely answer all your questions. Okay, and make sure you stay to the very end because we'll be doing a free drawing for a 1 year free Picmonic subscription, and you must be here present to win it. And we will announce that at the end of the webinar. And also, this will be recorded and available on YouTube tomorrow. And we'll also send you out a link to your email that you use to register for this here webinar today. Okay. And make sure you stay tuned to the very end because we have a very special promotion for, of course, Picmonic, my absolute fave. I use this almost every single day when I discovered it in nursing school. So, a little background about me. My name is Janine Sampson. I'm a newly licensed pediatric nurse practitioner. Yes. Yes, I'm a certified pediatric nurse practitioner, primary care, not acute care. I just got my license and my certification in February. I took my certification exam actually in January. I didn't receive the official notice until a few weeks later, but I definitely took it in January, received my pass. You get your pass notification as soon as you pass or fail, right there before you leave the testing center. I discovered Picmonic through another fellow YouTuber. I love YouTube, watch lots of YouTube, and found a YouTuber influencer who also was in FNP school, and she was talking about Picmonic, and me and my friends was discussing, and I was like, yeah, I think it's something I want to try. Fell in love with it, and I've been using it since. Um, how do I use Picmonic? I use Picmonic, like I said, almost every single day. My favorite feature was the playlist feature, and they have so many new features now. But one of my favorites was the playlist feature. And what I would do is whatever module we were studying that week, whatever topics we were studying, whether it was HEENT, which is head, ears, eyes, nose, and throat, or whether it was GI, whatever the topic or the system we were studying, I would go and look at all the Picmonics they had available for that, and then I would create myself a playlist. And what I like about the playlist is once you create your entire playlist with your favorite Picmonics, you can click play. And what happens is it plays every single playlist in that category, and you can play the educational or the story mode, and it just plays right through straight to the next one. Um, Two of my favorite Picmonics I always and still now, even though I've been a nurse practitioner for 7 months, I am still using the pediatric milestone and a pediatric vaccination schedule. I actually recently just started in primary care September 1st. Up until now, I've been in urgent care. So, urgent care issues are, you know, cough, stomach ache, diarrhea, vomiting. But in primary care, we focus on growth and development and making sure our pediatric patients are growing and developing appropriately based upon their age group and where they're supposed to be based upon age. And also making sure we have those vaccines up to date because here in the state of Florida, you have to have an updated vaccine record before you can enter the school. And so I really have to stay on top of my vaccines. We were just talking today. A patient was behind in his vaccine schedule, and I have to know, like, okay, which vaccines did he miss? Which vaccines were he supposed to get? When was he supposed to get these? When can he, when's the last day he can get these based upon his age? So I definitely still use the vaccination and milestone um, playlist, and I just listened to them maybe 2 days ago. I don't use it every day anymore, but I still use it quite often when I do need a reminder and a visual reminder because I am a visual person. So I love to talk and ramble. If any of you have come from my YouTube channel or my Instagram page, I love to talk. But let's get into today's webinar. So, the very first thing you want to do is examine your study habits. Where I'm here to teach you how to be as successful as possible and make it through nurse practitioner school. And these are some tips and tricks that I lived by and swore by while I was in school. So, the first thing is to examine your study habits. I know oftentimes we want to do what we did in undergraduate when we were studying to become registered nurses, but it's a little bit different. So you can't study the same as you did. Another first things first about that is creating a dedicated study space that is clutter free. For me, if I see clutter anywhere in my peripheral, I'm going to stop studying, or I'm going to be focused on what's going on over in the room and not focus on studying. So making sure you're in a dedicated workspace that is clutter free and making sure you are honing in on what needs to be studied at that time. And I know for me during undergrad, I found a study group, but when I was in nurse practitioner school, a study group just wasn't feasible for me. So maybe find your people. And I know it's kind of hard now because most of us are all in school virtually, or I was in school virtually the rest of my last year of nurse practitioner school because that's when COVID hit. So if at all possible, create a study group. You can definitely create a study group here on Zoom and Microsoft Teams if that works for you. That really helped me get through my undergrad when I was studying to become a nurse practitioner. And sometimes I would study with a friend in nurse practitioner school, but not as much. I really do love study groups. But if that works for you, make sure you're doing that. And last thing, when it comes to examining your study habits, is create a study schedule. Create a study schedule and stick to it. I would plan to study at least for 3 to 5 hours, if at all possible, or longer, and definitely taking breaks in between. So, what I would do is I would study for 40 minutes, then I would take about a 5 to 10 minute break, study another 40 minutes. I would do 3 40-minute sessions before I would have an hour break. And I would do that for about 5 hours. So, just making a study plan, sticking to it, and that's your first step at becoming successful in nurse practitioner school. All right, next up we have study smarter and not harder. Prepare before you go to your class. Use your course syllabus to create a study routine, read the material, and watch the Picmonics that covers that material before you go. Make sure you take those quizzes, and when you attend lectures, you would have kind of a brief overview of what you've already studied and kind of have an understanding, and it would help you to learn and understand more if you see that content prior to going to class. And that way you can also ask any questions that you need for clarification, and get additional help and ask the teacher to explain in greater detail any concepts you had a hard time grasping. Some topics are a little easier to grasp than others, so you may not need explanation, but some you're like, okay, can you explain this to me? Like pharmacology. Pharmacology can be a little difficult. So, and Picmonic has a pharmacology component as well. I studied the antibiotic classes like almost every day during pharm. And leading into asking questions is number three, honor your role as a student and ask questions. You can't learn if you don't ask. Don't be afraid to reach out if you need help and you don't understand a concept. Never be afraid to ask. I am still a novice provider and I was asking lots of questions today. I had a kid who failed their vision test and he has astigmatism in both eyes. And I couldn't remember, like, okay, his was 2070. And for a 5 year old, it should be 2040. And I couldn't remember at that moment, in the moment, like what it should have been. And definitely when it asked another provider, like, hey, am I supposed to send him to ophthalmology for this? Or is this something that we can wait and watch at his next visit? So never be afraid to ask questions, because my philosophy is you don't want to do a disservice to your patients. At the end of the day, you're doing this so that you can become the best provider, the best nurse practitioner, so that you can provide help and care for patients. So, everything we do, keep them in mind. How would you want someone to care for your family member, your grandmother, your child? Would you want them to just study and make it their way through school with a C or a B and just barely know what they're talking about? You always want to ask questions, and that way you can know and understand. And tip number 4, we're almost there. It's never too early to start thinking about your certification exam. As soon as I got into the clinical portion of my program, I started using my certification prep book to study for all my tests. Like I said, whatever body system, whatever topic we were studying that week, I would look at my Picmonic, and I would also get my certification prep book. I would read through that topic in the book, that chapter in the book, and answer the questions so that I could properly prepare for my test in school, and also preparing myself for my certification exam. Most schools and professors are writing the questions on their test that you will be taking in school that are similar to how you would take your the questions that you will see when you're taking your certification exam. So making sure you are going ahead and you are studying now. Um, I'm pretty sure there's probably FNP, maybe PNP students, or NNP, or GNP, gerontology, nurse practitioner students. For I know for FNP and most adult certifications, you would either choose ANCC or AANP for your certification body. For pediatric nurse practitioners, I think the only certification body now is PNCB. And you just make sure you go to either one of those websites, whoever you're deciding to get your certification through. And what you want to do is pull up the test blueprint, and you want to use that as a study guide to guide you through school. And even when you're getting ready to study for your certification exam, use that to help you guide you through your studies, through your certification exam. And making sure you're studying high yield content. Like for pediatric nurse practitioners, something high yield is definitely otitis media. And I probably since February have diagnosed ear infections a million times, maybe not a million, but definitely almost a few thousand. Like my numbers are getting up there. Vomiting, diarrhea. How would you treat that? Like I see some of the same things all the time. So make sure you are doing your high yield questions. I know for the PNCB, the test is geared towards um the test is geared towards what practitioners are seeing currently in practice, which is why they change the test so often. So we're definitely still seeing a lot of otitis media. We're definitely seeing appendicitis, things of that nature. And so you need to know how to treat those common diagnoses that you'll see. And last but not least is taking care of yourself. Self care, self care, self care. You want to make sure there's no drama in your life. Make sure your family and your friends know that you're in school and that you're about to be getting busy, especially when you get to like that second year, when you're getting more into your clinical rotations. It's going to get very busy. So you want to let your family know that you're going to be busy, know that you may miss out on a few things, but also you want to dedicate some self care time to yourself. Only yourself, not taking care of your husband, the pets, and the kids. Just having a moment to yourself, because that's what's going to get you through school, and that's what's going to keep you sane, especially if you're still working as a registered nurse. Like I worked full time and went to school full time. And so it was very important for me that I went from my monthly massage to Massage Envy, or I just took some time to myself to just kind of decompress, watch my favorite show, take myself out to my favorite restaurants when they open back up during COVID, and just making sure you're creating that time for yourself and creating a good emotional safe mental space for yourself. That way you can make it through nurse practitioner school, Join me on the other side so that we can all be practicing providers. And that is it. I feel like I went through that really fast this time, but not on purpose, not on purpose. I'm just really passionate about being a nurse practitioner. I love what I do, and we are needed. Like, we need more nurse practitioners. My office is so busy. We're seeing about 100 and 150 patients daily. In the urgent care that I work at, I see about 30 to 40 patients by myself there in a 4-hour period. So we're needed out there, you guys. Alrighty, so a recording will be available tomorrow morning on YouTube, as I said before, and we will email you a link. The winner will be announced later on after we do our Q&A. So let's get started with our Q&A. Alrighty, so I am a pediatric nurse practitioner provider. I was about to say student. So for me, let me show you which book that I use. I love this book and I still use it now to reference as a quick reference manual while I'm working. And it is the 7th edition of the Pediatric Nurse Practitioner Certification Review Guide by Seelberg and Flagg. As you can see, it's kind of worn and tattered, but I still use this. And like I said, I pretty much use it daily or whenever I practice. So probably daily. One of the great things about being in primary care is I usually review my schedule before I go in, the night before I go in, and I could kind of see like what patients are coming in for. So if it's a diagnosis or a complaint that I haven't seen before, I go ahead and try to do a little research on it just to like jog my memory of, oh, okay, this is what I want to do. This is how I would treat this patient. This is what I'll look for. And I either use my quick reference book here or this pediatric primary care book, which is another gem, another quick reference. It's straight and to the point and very easy to use. It tells you exactly the diagnosis, the ICD-10 code that I would use to type in my charting, the signs and symptoms to look for, how the patient could acquire it, the treatment, if there is any treatment, and the education that you would give the parents. All right, next question is, I am about to go into clinical and I'm nervous that I don't really know the material. What do you recommend? I'm still nervous that I don't know the material either. Just kidding. The next that question is a little vague. So are you a PNP student or are you an F&P student? I think it depends on where your rotation is. So if you are in urgent care or if you're in a primary care office or if you're doing a specialty, I would just study whatever that specialty is in that you're going in, or I would study and in your certification book. She said, oh, okay. PNP primary care. So, in where you're going to be doing your clinical rotations? I did my clinical rotations at an urgent care. So, I would ask what are the common diagnoses they see, which is not uncommon. You can ask your preceptor what are the common diagnoses that they see, and she can give you a list of the common diagnoses. And if you don't have this book, I would get it, or you can use your Burns book. That's what we use, or your textbook. We use Burns in my program. So I would just go ask for the common things they usually see. Today, what did I see? I saw lots of cough, fever, vomiting, diarrhea. So what you want to do is GI, you want to do respiratory, and you want to do HEENT. Those probably are going to be your top 3 things that you're going to see and study those. How did you prepare for clinicals? What resources or apps did you use? Um, I just kind of studied the material in school. Once I started getting in the groove of going to clinicals, I would just research whatever came into the office. Um, I was at clinical like at nighttime. So the next morning or the next afternoon, whenever I got up, if I was off that day, I would just research everything that I saw in clinic. As far as resources, I used my certification book. I use that the Richardson book, this pediatric primary care book. They pretty much have basically all the same information. I researched my in my Burns book, and I made myself this cool little study guide. I'll show you. So basically, it is, I made this table, this chart, and this will be for one single diagnosis. And so I would put pathology here, like how did it occur, what was the diagnosing that the disease I was diagnosing, the treatment and medications that I would use, the diagnostic tests I would use to confirm diagnosis, to rule in or rule out, signs and symptoms that I would typically see, patient education. So what patient education would I provide to this mom or to the parent if they're a teenager about this particular diagnosis and their particular complaint that they're coming in about, and any differential diagnoses. Differential diagnoses are very important because you don't want to miss anything that it could be, and it expands your thinking and like, okay, what else could it be besides an ear infection? What else could it be besides sinusitis? What else could it be? Why is this patient here? What else could it be besides syncope? Those are some of the things that I saw today. So I would come home and write this out for each diagnoses that I would see or diagnose in clinical, just to kind of work it into my memory, my muscle memory, and read it every single day and read it in the book. Any recommendations for F&P certification exam book? Um, that would depend on which certification board you decided to use, either ANCC or the AANP. I would go to their website and see if they have certification books, or definitely ask any family nurse practitioners that you may know what certification books they did use. I think there is a family certification book that looks similar to the one that I use for pediatrics, but I'm not really sure about FNP. But definitely go to your certification body's website, whoever you decide to use, and maybe asking colleagues that you may know who are FNPs which board certification they use, and kind of just go from there. What book do you suggest for adult primary care? Unfortunately, I don't have any recommendations for adult primary care. I've been a pediatric nurse for 7 years prior to even going into becoming a pediatric nurse practitioner. So my knowledge base for adults is very limited, and I'm not really sure. I'm pretty sure if you type in, because last night I was looking for more books. I'm a little bit of a nerd when it comes to being in the healthcare profession. And I just went in and typed in pediatric primary care and kind of looked at the reviews for some books that I am considering purchasing. And just look at the reviews and see what people are saying. Getting a preceptor for clinicals, I heard, can be difficult. What would you recommend for tips to get that going? Also, did you have to pay for a preceptor? That is a great question. Great question. Because I reside in the Tampa Bay area, and I went to the University of South Florida, and my top choice was the University of Alabama at Birmingham, but I had the same concern that it was difficult to find preceptors. So that's why I decided to go to USF, because they found our clinical sites for us, and provided also preceptors at those clinical sites. There, unfortunately, you may have to pay for preceptors if you can't find any. So I am assuming you're a nurse. I'm just kidding. I know you're a nurse. So what I did was I asked around when it got pretty tough for us during COVID, and a lot of places wasn't taking students anymore. And I needed to get my hours. So I kind of asked around like, hey, are you taking students? And so I had a mentor who took me under her wing and let me do my clinicals rotations with her. So reaching out to people you may know who are in the specialty that you're in, whether it's F&P or PNP. Or another thing you can do is call around. Actually, at the urgent care that I still work at as well part time, I was answering calls, and there was a student who called to see if we would take students, and or if there providers there who would precept students. So that would be my next thing, is to ask colleagues that you may know, or call around to offices that are in your area and see if they're accepting students and if they're willing to take students under their wing. Or number three, there are these preceptor companies now, but you have to pay in order to be precepted. And so I would try the first two options first. Hopefully, definitely, there's someone in possibly in a hospital or in an outpatient setting that you know. Ask a friend, to ask their doctor. Like just try to network in your community first before doing that paid option, which I know a lot of students these days are having to do. I'm just starting advanced pharmacology. Any suggestions for success? Same for pathophysiology. Pharmacology and pathophysiology, you have to put your time and dedication into it. So for those two classes, I would definitely amp up how much time I'm studying. And for those, there may not be too many Picmonics for the pathophysiology. I use Khan Academy for some of the things that, because it goes like to like a molecular level in pathophysiology. So I use Khan Academy for those to kind of get a greater detail. But you're going to have to read your book, possibly do a study schedule. I'm a visual person, so maybe writing and drawing concepts on your mirrors, on your showers, and things like that. How do you succeed in Patho? What tips and tricks do you have? How does this class play a role in your everyday practice? Um, Patho, while it seems like it's unnecessary, but you need to break things down at the very, like from the very beginning. Like, how is this really happening? How does this work? So you need to know exactly how everything head to toe works before you are able to understand why you're diagnosing, you understand why you're prescribing certain medications. It's the why to what is going on with this patient. And so you need to understand why these things are happening before you're just going out there and saying, I want to be a nurse practitioner and I want to diagnose asthma. Well, how does the respiratory system work? If you don't know how the respiratory system work, and especially in pediatrics, these parents, they ask the weirdest questions, and it's like, I guess I need to know how this works. So you need to understand the why it works, the how it works, and that's what pathophysiology provides. And it's something that you really should take seriously and make sure you're studying and setting aside the time for it. Which books do you believe are a must to have as physical copies instead of PDFs? That's a great question, because everybody in here is probably much younger than me. I personally am still a book person. Anything that is required, like your Burns book, anything that is has diagnoses in it and your medications in it, you're going to reference those things all the time. It's just easier to have it as a physical copy versus having it as a PDF copy. That just may be the old school in me, but I feel like I can quickly reference it for me, like if I could just pick up my book. But I guess it's kind of the same. It's just personal preference, to be honest with you, just to be quite honest. It's going to be personal preference, because you probably can find what you're looking for a little bit easier in a PDF copy just by going to the search bar. So I think that's kind of personal preference is where I'm going to leave that at. I personally still like to get books, have the physical book so that I can highlight it, have it right next to me, just because I don't want to be switching through screens. I'm already spending enough screen time at work, so I don't want to be switching and on screens while I'm reading my books. Alrighty, so I think that's it. There are no more questions. Are you guys ready for the winner? The winner is Miss Sharon Briggs, and the link to your promo is in the chat. So, as I said before, I kind of went through the outro first before I did the question and answer, but a recording will be available tomorrow morning on YouTube, and we'll also email you guys a link that you use to register for this Picmonic webinar. The winner, as I have announced, is Miss Sharon Briggs, and the link is to the promo is in the chat. And are you guys ready? So 30% off when you subscribe to Picmonic in the next 24 hours. There are two ways that you can get to this. There will be a link right now in the chat, or you can wait an hour and Heather's going to send out an email once again that you use to register for this Picmonic. I am so glad I was able to talk with you guys. I really have fun chatting with you. If you guys have any questions, the links to my YouTube and the links to my Instagram are both in the chat. Just head on over see some of the videos over there on how I use my Picmonic. You can leave me questions there, or you can leave me questions in my DMs over on Instagram. I usually reply pretty much the same day in between patients or when I get home and after I finish charting on all my patients. So it was a pleasure talking with you guys. I hope to see you guys over on YouTube or Instagram, and happy studying. Bye.